Here's a quick tutorial on how to use this unit for ultrasound. When you're doing ultrasound, you want to start by positioning the patient in a way that's going to be comfortable for the duration of treatment, and then expose the area to be treated and clean it to make sure it's free of any lotions or creams that might interfere with the treatment. Once you've done that, you come to the back of the unit here to press the power switch to turn it on. You'll come to the top left here to select the type of treatment you're going to use. We've got electrotherapy, ultrasound, or combination, ultrasound and electrotherapy. In this case, we're going to select ultrasound. Once you've done that, you're going to set the treatment time, and then you're going to come down here to select how you'd like the output to read in watts or watts per centimeter squared. You'll see that up here once we begin the treatment. So I'm going to keep that at watts per centimeter squared. You're then going to select your duty cycle, whether you want continuous or pulsed ultrasound, and if you want pulsed ultrasound at 50% or 20%. And then from there, you're going to go ahead and apply the coupling agent to the area. Now, we don't have a patient today. We keep our coupling agent in a nice warmer here so it's comfortable for the patient. You put that over the area to be treated. And it's important that that coupling agent, that you use enough of it, that as it gets spread out and absorbs, is going to still remain gooey over top of the area. Because if you don't have enough, that's going to make it more challenging to deliver the sound waves into the body. So you want to use a lot of that. You don't want to skimp there. Once you've applied the coupling agent to the area, you're going to come to the back here and get your sound head. There are different sound heads available based upon the treatment area that you're working with. And then you'll put this sound head in contact with the coupling agent on the patient's body. You need to make sure that that sound head stays in contact with the coupling agent on the body the entire duration of treatment, or you run the risk of damaging the crystals inside the sound head. Once you've started your treatment, you're going to go ahead and press this start button, and then you're going to continuously move the sound head over the treatment area while you're working with the patient. Most patients don't feel much of anything depending upon what you're working with. With a continuous treatment over a small area, they may start to feel some warm sensation over top of the area. Most times they do not. While you're doing this, you'll also come up here to this knob and you'll set the intensity of the ultrasound based upon what you're looking to use, based on the thickness or the depth of the tissue that you're trying to target. So at this point, you might come to 1.0 or 1.5 or 3 watts per centimeter squared. If at any time during the treatment, you need to pause the treatment to add more coupling medium, you're going to go ahead and push this pause button. That will stop the sound heads from vibrating, and so it will stop the administration of the treatment. You can add more coupling agent, and then before you push the start button again, you're going to go ahead and retouch the area with the sound head. Then press the start button to continue treatment. Most units are set to turn off automatically when the time expires, but if you stop the treatment short, or if it's not set that way, there will be an off button that terminates the treatment. And once you've hit that button, it's safe to take the sound head off of the treatment area, clean it up, put it away, and clean up the patient so that they're ready to go.